So good afternoon, everyone. My name is Peggy Chi. I'm very pleased to present to you my research entitled Turning Over a New Leaf, Links Between Nature Access and Outcomes in Long-Term Care. Now, we know about the health concerns in nursing home sectors around older adults who live in nursing homes. And these health concerns extend to their care staff, such as personal support workers, healthcare aides, and nurses. The majority of residents has some form of dementia, cognitive impairment, and half of the residents exhibit depressive symptoms, responsive behaviors, low social engagement. Now, residents' needs place high demand on their care staff, leading to work-related stress. Work-related stress impact individuals in various ways like feelings of stress, burnt out, and intention to quit. These experiences can impact their work and the organizations that they work for. Care staffs working in nursing homes experience higher work-related stress than those working in home care. Nursing home is not the same as home care, just to make sure that we're on the same page. It's not the same as home care, assisted living, supportive housing, or retirement homes. Nursing homes provides 24-hour nursing care. Outdated physical environments of nursing homes have been one of the neglected, long-standing challenges, which are inadequate for the people who both live and work there. But there is hope. So research has shown that the physical environment can promote health. In nursing homes, the physical environment refers to three main components. The first one is the built environment, such as buildings and infrastructures made by humans. And then there is the natural environments that consist of elements like daylight, living plants, other living things which are not products of the human creation. And then you have the naturalized environment, which is a combination of both the built and the natural. Let's start with the definition of natural environments in healthcare. This is typically a human-made space that contains elements of nature. It is both indoors and outdoors, and it should afford familiarity for its users. It needs to be carefully designed with therapeutic goals with functions as resources for positive health. The natural environments can be a permanent space like gardens, courtyards, and farms, but they're really just commonly called the outdoors. The natural environments can also be a temporary experience derived from interventions. For example, increasing exposures to daylight and living plants, and usually these interventions only last maybe a few weeks or a few months. And what do we know about natural environments' impact on prevalent mental health and well-being outcomes that I mentioned before? We know that indoor gardening and outdoor agricultural activities has shown to improve social engagement. We know that the introduction of a new garden has shown to decrease antidepressant and antipsychotic intake. Meanwhile, the evidence for depression and responsive behavior has been mixed. We know very little about care staff, but they have reported their use of the natural environment to feel relaxed and to feel calm.